Welcome to Sante Lakay, a coffee talk podcast brought to you by Zanmi Lasante. I'm Corleen Rosette, the Director of Development and your host. I'm thrilled to welcome you to this new series where we'll be joined by experts and leaders across Zanmi Lasante's departments and sites. In each episode, we'll be joined by those on the front line of healthcare in Haiti, sharing insights, challenges, and successes across a range of health topics impacting our communities. From managing health programs in rural areas to responding to public health crises, our leaders will give you a close-up look at the work happening every day to improve lives. So grab a cup of coffee, sit back, and join us for candid conversations about health, resilience, and hope, right here at Sante Lakay. Hi, everyone. Thank you for tuning into this month's episode of Sante Lakay. My name is Corleen Noisette. I'm the Director of Development for Zanmi Lasante. Today, we have Dr. Alain Casseus, who is the Divisional Director of Infectious Diseases at ZL. Today's topic, we'll be discussing how Zanmi Lasante's legacy has impacted the fight against HIV, AIDS, and TB in Haiti, how the USG foreign aid freeze could affect ZL's HIV programming, and what remains to be done to achieve the 95-95-95 clinical targets. So, Dr. Casseus, before we get started diving into this topic, could you please share a little bit about your background?
All right. Hello, Corey. So some people know me. I've been working in Zanmi Lasante for quite a long time. I started with social service back in 2007, which ended in 2008. And afterwards, I was on and off contracts with ZL until I became an employee, a regular employee in 2010. And I've been with ZL ever since. I started an HIV program. Eventually, I changed departments completely and went to work for the Department of Strategic Information as General Coordinator. And during that time, I also worked as project manager until I transitioned completely to project management, managing multiple projects involving research, the U.S. government, Colorado nutrition, very different, multiple different topics. And eventually, when the previous principal investigator for the PEPFAR project left, and then ZL had created a department for the Division for Infectious Diseases, I was offered the opportunity, which I accepted, and now here I am.
Thank you so much for sharing that background. It's wonderful to have you with us today. I know you have a wealth of knowledge to share with us. So in our last episode, we talked about the history of Zanmi Lasante and how HIV and TB became the backbone of our work. Could you please take us back to those early days, what it was like starting this fight and where we are today?
Okay, for ZL, the work started as probably you have spoken maybe in the last episode, all the way back in the 80s. You and I were probably children at the time. Back in 1983, when Paul and Ophelia started working in Cange with a clinic for patients, and eventually when the HIV pandemic started really, started being fought with antiretrovirals, it was mostly thought that countries like Haiti, it was unviable for the treatment to be sent to these places, as it was very costly per patient. And well, I guess Paul had a vision that he had continued over his life, where he wanted to prove that it was possible to do this despite the cost, and they decided to actually implement to start the initiative in Haiti with a certain number of patients to see how it would be. So around that time, it cost around $10,000. As you know, when medication first start, they have a very high cost, and eventually when they get to be generic, the cost really cuts down. But in the beginning, it really was costly, and I'm sure it was very difficult. But for now, we grew from those 50 patients in the Central Plateau, up to almost 18,000 patients right now in March. that are receiving care in antiretrovirals. And those 18,000 patients are active patients. So we could say that right now we have these patients, but we can say at least double of that have received care from Zanmi Lasante with the treatment that some people at the time thought was impossible to implement in countries such as ours.
Wow, that's amazing. One of the biggest lessons we've learned from those early days was that to truly fight these diseases, we couldn't rely solely on hospital-based care. That's where community health workers became really essential. Can you talk about how they changed the way ZL delivered HIV and TB care?
I would say they changed the way Zia gave care in general. And it also shaped a lot of PIH's work. It shaped also work from other partners because I've been to multiple conferences in other parts of the world, even Asia, where they are in some ways implementing what we have started here in Haiti back during the early days of the HIV epidemic, which is the accompagnateur cadre of community health workers and community health workers in general, where it was mostly a vision, or we used to call it a paradigm, where health was mostly seen as the disease that the person had and not the person as a whole. And this is one type of disease, and almost all chronic diseases are like that, whether they're infectious or non-infectious. You have to see the person as a whole, not just the disease. You have to see every single part of them. There's the social aspect, the economic aspect, the psychological support. And the accompagnators were there not only to provide the medication and ensure the person takes the medication, but they were also a friend, a counselor, someone they could talk to, someone who could watch them, keep an eye on them, refer them if they have any other needs. And this was also an aspect that other programs right now, such as NCD programs, non-communicable diseases, are looking at, because the other determinants of health are as important as fighting against the disease. If the person doesn't have anything to eat, if the person isn't feeling motivated, they will not be motivated to take the medication either. So you need to look at the person as a whole, and the accompagnators and the CHWs in general are at the core of the program ever since then.
Yes, thank you. I mean, you just touch upon one of the essence of our work. You know, we have a network of over 2,000 community health workers at Zanmi Lasante, and they really help us push our holistic approach. As you noted, you know, they're friends of the patients. They come from the communities. They really are able to give us a bigger picture of the patient as a whole, what their living conditions are, if they need other some, you know, social support needed. So it's truly really, as I noted, the backbone of our work. So with such a strong community-based approach, Zamana Sante has been able to reach thousands of people. Looking back, what do you see as the biggest impact of this work?
Well, the biggest impact that ZL's work has had, and the first that comes to mind, is that more than a lot of other partners, we've been a strong supporter of the local health system. Everywhere we've went, apart from Kaj, everywhere we've went, they are all Ministry of Health facilities that we are reinforcing and supporting. And the work we are doing is in support of the Ministry of Health, whether it be HIV, TB, nutrition. All the work that we're doing is in support of it. And we've been able to, and for the areas where we work, we've been able to at least achieve a certain amount of coverage, not only in terms of availability of services in those institutions, but also coverage in the community with the community health workers, on top of the huge amount of collaborators that we have. And also, if we go a little deeper on the community member side or the individual side, is that we've been able to provide life-saving care to people who probably would not have access to it. And not just HIV. I know this is the topic, but not just HIV. Don't forget that we also have cancer care, and people come from all around the country for this. We also have malnutrition, which is killing kids in a lot of other parts of the country, and we've been able to reach them in the community, not just waiting for the kids to come to the institution. And also providing uh, other types of support. For example, all the orphans, all children that were affected by either HIV, TB, or any other form of event, we also gave them some support. And at the same time, we also gave our expertise to the Ministry of Health in other areas also, if the need is felt. For example, during cholera, during COVID, they called, they asked us for the support. We answered the call. During Matthew, when there was the hurricane, they asked us for support. We went there. We gave the support outside of our catchment area because we are always there to support the communities where we are.
Zeal's work has transformed so many lives, but sustaining this level of care isn't always easy. How does funding uncertainty affect both healthcare workers and the patients they serve?
Well, funding issues is I'd say it's a countrywide problem and even worldwide, especially for countries such as Haiti. For the HIV program and also TB, I'd say the program is mostly funded by CDC PEPFAR for HIV, and also with some support from Global Fund. The TB program is mostly supported by Global Fund. We also have had some partners giving us other support, such as MacAIDS. But just to cite a few, MacAIDS, we've had also other parts of CDC giving other support, like the CDC Foundation. So this uncertainty, well, it creates issues because don't forget that if for whatever reason the funding either stops or diminishes greatly, our ability to continue providing certain services will also diminish because we are a nonprofit. We do not generate revenue. So the minimum we would still be able to do a minimum for our patients, but not provide as an holistic level of care that we would want to, given the great amount of funding. Because I'd say PEPFAR is more than 80% of our funding, and it covers almost every single area aspect of the care, except for medication, which comes from Global Fund, and some of it also comes from funding that we find from generous donors and philanthropists in different parts of the world. So we are a very large organization, and we have a very huge catchment area. The reason why we have so many patients is because a lot of them come from outside the Central Plateau and the Artibonite region, either from Port-au-Prince, from the north. And it also speaks to the level of care that we're providing. And for this reason, we really need support from the donors to continue giving the care that we're giving. And if not, we, of course, need to be able to find ways to at least give the most life-saving parts of the care, which are the medication, and especially focusing on pregnant women and children in order to ensure that we, as much as possible, cut the chain of transmission and keep reducing the incidence of the disease, while at the same time ensuring that those who are under our care live as long as possible.
Thank you. Yeah, and as you mentioned before, there's almost 18,000 patients that are, looking towards CL for treatment and care for this disease. And so, the reduction in funding is going to significantly affect the outcomes that they have in their lives. And I know, PEPFAR is, as you mentioned, one of our largest funders for HIV and TB, but even that funding doesn't cover all the needs that we have. And so ZL really supplements additional funds for our patients in terms of, nutritional support or transport stipends and other areas that feed into the holistic care of the patient.
Yes.
So, despite these challenges, global health leaders have set clear targets to keep us on track. Could you please explain the what the 95, 95, 95 goals are and why they're so crucial to this fight?
The 95, 95, 95 goals are the simplest aspects of these indicators because it does get more complicated. Because on top of the 95, we have 690s, we have 10s. But this is the most basic aspect where the first 95 involves diagnosing 95% of people that are estimated to be living with HIV. And of those people, ensuring that 95% of them are on the antiretroviral treatment. And also ensuring that we achieve viral load suppression, meaning that the virus is suppressed and the person is not able to transmit the disease. Viral load suppression for 95% of the people who are on antiretroviral treatments. It's a goal that is not just for ZL, it's tracked for the entire country and for the world. And I'd say per continent, it's being looked at how it's evolving at each location. Um, we're pretty close, I'd say, and we are evolving in a positive trend, although not as fast as we would want to. Um, for the Central Plateau, we practically reach the first 95. We wouldn't be too far from the second 95, but as you know, unfortunately the current situation doesn't help with providing the services as well as we would, because we have a certain number of people who have difficulty getting the medication. It's difficult for them to travel to and from the health centers. And there's also the issue for the third 95 where the testing is mostly done at the national lab in Port-au-Prince. So getting the samples to the lab is another big problem. But incidentally, and it's kind of ironic, I recently participated in a symposium for HIV with mostly nurses. And it was interesting to see that, and largely, mostly from what I've seen, they're presenting, we're doing quite well and even better in a lot of cases than countries like the US,
Oh,
which I would not, yeah, which I found very, it was not what it's different than what I would have thought. It's really different. And there are certain approaches that we are implemented in ZL and Haiti that they are trying to copy in the US because they've been trying to do it in a different way. And they realize that what we're doing works better. So they kind of implement it there also.
thank you. So now that we understand the importance of these goals, I think you touched a little bit upon this, but where ZL stands today, and so what progress has been made. You touched a few points on that, but what still lies ahead for us?
Well, we still have a lot of work to do because the first and second 95s are a little less problematic for us at the moment. Although the Altibonite region, given the security situation, um, does pose issues, although it's been in a lot of aspects progressing a little better than the plateau, just because we know that we have to do more effort there, and the effort really is being done. For the viral load suppression, we are a little below 90% in each of the departments. We would want to be at least at 90, and we're hoping at least to reach 95 by the end of this year. We don't know how that's going to happen. But in the long run, our contribution is going to be very important because our results account for almost 100% of the Central Plateau's results and more than 50% of the Artibonite region, despite us being only in 3 communes in the Artibonite, but we have a very, very large number of beneficiaries taking care at our centers. So there's still a lot of work to be done, and we are hopeful that given the current positive trends, if things get better, we will be able to work much faster. If not, we will continue to keep providing the effort that we're giving, trying to do even more if possible in order to ensure that the country in general gets a better handle on the disease. This is important also because the better our results for the country are, also the most probable that we will get continue to get funding for the program in the country.
Yeah, that's key.
Yeah.
Well, thank you so much for this insightful conversation. I feel like we learned a little bit more about our HIV and TB programming and the impact we made so far. So I just want to say thank you, everyone, for tuning in to today's episode of Sante Lakay. I hope you found this conversation on our HIV and TB programming in Haiti insightful and stimulating. A big thank you to our guest, Dr. Alain Casseus, for taking the time to speak with us today. If you enjoyed this episode, please consider subscribing to our newsletter and podcast, leaving us a review, and sharing it with your friends. It's really going to help us grow and reach more listeners like you. Thank you.